Well, I think it was a great session all in all. It was certainly a challenge. We had to really deal with a coordinated attack by the insurance companies, the health plans, some of these business groups on health, really attacking us on the cost of health care. This session, given our significant ask with the budget and all of the defense we were playing on these issues, we really needed grassroots engagement, and our members came through with flying colors.
Texas hospitals entered the 88th legislative session on the tail end of a pandemic that left them reeling, and were faced with the demanding task of rebuilding amid mounting anti-hospital rhetoric. But THA was undeterred, advocating for key hospital priorities, such as workforce training, coverage expansion, access to behavioral health care, and workplace safety. Many of the biggest wins for Texas hospitals came in the budget, which saw strong funding for rural Medicaid coverage, behavioral health and women's health coverage, and workforce programs.
The largest item of appropriation in the state budget every year, or one of the largest, and the one that's of major interest to hospitals, is funding for our Medicaid program. So we were pleased with those outcomes on the Medicaid payment side for hospitals. Additionally, the legislature was generous for rural hospitals in a couple other areas. We saw an increase in the Medicaid rural labor and delivery add-on payment from $500 per delivery to $1,500 per delivery that will take effect next biennium. That's going to help shore up maternal care in rural areas of the state.
Workforce was a particular point of emphasis for THA, including protecting hospital workers. In an era in which data shows violence in hospitals has increased, THA pushed lawmakers to act. Two major workplace violence prevention bills passed that represented the linchpin of THA's workplace safety efforts. One new law requires all healthcare facilities to establish plans to prevent and deal with workplace violence. Another enhances the penalty for assaulting a hospital worker to a third-degree felony. And in addition to workforce funding in the budget, THA's advocacy helped pass a sweeping post-secondary nursing omnibus bill that will help rebuild the nursing workforce through nursing grants and scholarships, and through enhanced loan repayment assistance for working as faculty in a nursing degree program.
We heard from our members loud and clear in 2022 that their biggest challenge was the workforce and the depletion of the workforce post-COVID. And I think, through the work of the THA Task Force on workforce and our Kaufman Hall report, we were really able to tell the story of the challenges that our hospitals were seeing in workforce.
Improving behavioral health care was also at the forefront of THA's agenda.
We were primarily focused on increasing the continuum of care. A lot of that, of course, is focused around coverage where we could get it. We have been working since 2019 on streamlining processes within the emergency detention code and within the orders of protective custody code. We had multiple bills in this space.
Along with funding wins to boost behavioral health, a bill that requires electronic emergency detention orders to be available across the state will also help at-risk patients get the services they need. Maternal Medicaid coverage in Texas, pending final approval by the federal government, will get a boost that THA and many others clamored for. Lawmakers passed House Bill 12, which will extend Medicaid coverage for mothers from the current 2 months postpartum to 12 months. The state's implementation of that landmark bill still needs approval by the Centers for Medicare and Medicaid Services. A clarification on end-of-life care, featuring months-long collaboration between THA and other stakeholders, was also a landmark achievement.
After 10 years of working for THA on a number of issues, but in particular end-of-life issues as it relates to the Texas Advanced Directives Act, I can say for the first time, we were able to walk into an office and sign essentially that we agreed with all of our other partners from a very diverse set of background on basic principles that seek to improve that product. And so the fact that THA with TMA, a lot of life groups, Catholic Conference of Bishops, disability groups, et cetera, were able to come together and make reforms to that statute is fairly impressive.
While THA victories spurred needed progress for Texas healthcare, this session also saw intense attacks from anti-hospital forces, and legislation backed by the health insurance industry that threatened to chip away at access to care and pad insurers' pockets. But throughout session, THA kept its members and the public informed and engaged through weekly updates, white papers, advocacy alerts, and other communications efforts that stressed what hospitals needed and the dangers of those insurer-backed proposals. THA fought off efforts by legislators to outlaw hospital outpatient payments and institute government-set caps on payment rates.
This legislation threatened the very survival of Texas hospitals, and it was the heaviest rate setting or really rate prohibition that I've ever seen that's gotten any movement. I've never seen anything like this from an advocacy perspective, and how hard we pushed against it and how much member engagement that we've had. We ran a survey on cost. We convened special meetings of your GR teams. We created new advocacy alerts that were meant for internal and modification purposes. Ultimately, it was heard in the House and Senate, but we were successful in preventing either committee from moving it forward. And really, that is a thanks to the massive grassroots effort.
Hospitals fought uphill against these attacks in the 88th session, but with the help of hospital voices engaged in multiple targeted grassroots efforts, THA was able to avoid what could have been severe damage to the healthcare landscape across Texas. Instead, in an unprecedented time, hospitals stood strong and gained vital ground for the future of Texas healthcare.